Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the lumbar spine. It is the Bowstring Test, or the Bowstring sign, or what else is it known as? What is it? The popliteal compression test, the posterior tibial nerve test, or the Cram Test. So this one is a test to diagnose sciatica, or like nerve root compression. And from what I understand, this form of the Bowstring test was described by R.H. Cram back in 1953 in a paper in which he was just looking at like modifying the straight leg raise and found that there was some tension of the posterior tibial nerve when you tension the sciatic nerve. Now, while I said there's a difference in the Bowstring test, there is another Bowstring test that deals with ankylosing spondylitis, and we may talk about that one in the future, but for time's sake, let's talk about this Bowstring test right now. To perform the test, you have the person lying on their back, so lying supine, and you can test both sides. But say symptoms are on this side, we perform a straight leg raise, just like how we do. So once you produce the person's symptoms, you flex the knee about 20 degrees, and then you apply a pressure into that popliteal space. You can use your thumb, you press into it. And if it reproduces their symptoms, it is a positive. In terms of the research, there is a little bit out there. I will tell you, when you get into any of these like nerve tensioning tests, these neural tests, they kind of throw them all together. They'll do like the straight leg raise and the slump and this one. They just throw them all together and they do research on them. But there is a paper from 1976 in which the participants had a 100% confirmed compression of the nerve root and found that the Bowstring test had a 69% sensitivity. There was also another paper in 2025, so just this past year, in which they were looking at inter and intra-relator reliability with this test. And they found with the inter, so between researchers, it was pretty poor reliability, but within intra, so with a person, it was like fair. So it's just kind of hit or miss really with this test. Anyway, that is the Bowstring test or the Cram test or any of those other names for it. So let us know, what do you think of it? Do you use it? Do you like it? Do you remember it from school? Let us know down in the comments below. And as Mateo always says, take care of yourself, take care of your patients. We'll see you next time.